Hi, uh, I thought I will share with you guys regarding an experience which I obtained during my residency time. So this happened 1 year back. So the incident was I encountered a 56-year-old woman with a history of hypertension. She presented to the emergency department with fatigue and sore throat, a low-grade fever, mild shortness of breath, and on arrival to the emergency department, her heart rate was around uh, 110 beats per minute, and BP was 90 by 50 millimeter, and she also had she was given 1.5 liters of fluid, but her blood pressure continued to fall, and NORAD was started. So physical examination was normal with the exception of some uh, dry mucous membranes, and lab investigation showed a WBC count of 7,000 per cubic millimeter, hematocrit of 36, lactate of zero point 0.6, lactate was normal basically, and a bun of 45, creat was 1.1 mg per deciliter. So the chest X-ray was didn't reveal anything, and she was admitted to the intensive care unit. So the attending asked me regarding my plan. So what is your assessment of the patient? And as a resident, I was like, sir, this is a 56-year-old female with a history of hypertension was sent us from the emergency department with sepsis. And the attending again was, this is quite interesting, and I'm puzzled. So what is the source of infection? How do you account for the low hematocrit in an essentially normal, essentially healthy female with whom do you believe to be volume depleted? So, well, I was like, so well, maybe it's pneumonia, and it might appear in the chest X-ray maybe in the next 24 hours. With respect to the hematocrit, and not really sure about what it could be. So then the thing is, I wanted to say is that so I was operating at quite a low level of thought process, lowest level of thinking. So basically, later I learned something called as critical thinking. So critical thinking per se is a separate mm, psychological concept. So the basic funda will be how to operate on your thought process in different taxonomic strata. So there is something called as Bloom's taxonomy, which gives, which is a pyramid basically, which has different stratifications starting from the remembering, understanding, applying, analyzing, evaluating, and creating. So this will be the strata from down to up, and during that time I had been like operating in at the lowest level of thinking as per this Bloom's taxonomy, which is remembering. So basically, I recollected the history that the patient is having fever with hypertension, so it must be something like a septic shock, and so the possible, after seeing this multiple patients in the sepsis, I resort to something called as a pattern recognition from multiple patients, and I've been following this pattern recognition way of diagnosis on most of the patients. So I've applied it to that patient. So this is something which is quite which happens at many places. So as a junior, so it takes a lot of time to understand. So later I respected into the my way of thought process, and I came to uh, conclusion and on how to operate. So then, so just imagine. So how this discussion could have been gone, and in what way I could have been better, and so just imagine an imaginary scenario. So what if the attending would have asked? So what do you think? Why do you think the patient has had sepsis? So and I should have told them. Well, she came and with infectious symptoms. Also, her blood pressure was low, and it improved only with fluids in the emergency department. So, the attending should have been like, well, okay. So, how do you explain blood pressure generation and also hypotension with taking into account of the other data, such as low hematocrit? So, one way to explain about critical thinking is to explain about the two processes of thought process and thinking. So there are two processes, broad processes. One will be the intuitive thinking. The second will be the analytical thinking. Type 1 thinking, more of a pattern recognition approach, which most of the residents would resort to. So that is what even I was explaining initially. So another approach is to discuss the biases faced by the resident, and the debiasing strategies must be promoted so that this uh, sort of thought processes can be diverted to the type 2 thought process, which is the analytical thought process. This is called as a critical thinking. So the resident in the scenario has described this as basically has fallen. The resident who is me, obviously, so has fallen to prey into multiple biases, and the debiasing strategies must be adopted in the mm, residents. And I think the this must be um, concept must be ingrained in each and every resident in the initial few days, so that the further days of residency would be much more productive than is expected. And so something like basically I've been fallen to a victim for two types of biases. One is the availability bias. That is, I encounter multiple or numerous number of septic patients. So obviously, I will be oriented towards the pattern recognition approach of the similar patients is encountered in the past. And the second one will be the confirmation bias, which is the low blood pressure and the dry mucous membranes and the clinical stigma, which forced me to label the patient as a case of septic shock. And so basically, what I wanted to say is that as a resident, we fall into multiple, prey into multiple biases, and this must be demystified through teaching multiple psychological aspects. And one such important stuff will be the Bloom's taxonomy and critical thinking. So I think this video would have made people aware of what mistakes people are doing in your initial residency days. So, though these entry eight concepts have been taught to us in classes, we don't take note of such stuff, and it's very tough to incorporate this in our daily day-to-day life. And I think practice makes a man perfect. So, as Albert Einstein says, education is not something which is the learning of facts, but it's the training of the mind to think. So, thank you.